I have learned an incredible amount of cultural information so far in this class, especially from Week 3's training. Not only did it discuss the importance of cultural competence, but it also included detailed information about different cultures that prepared me for what I need to know when treating patients that we do. The one that stood out the most to me was the cultural differences of the Romani population. I didn't even know that there was another name for them. Without this training, I wouldn't have known what to expect when treating them, or what to be sensitive to. Cultural competence is one major topic that pertains to me in advanced nursing practice. We treat cross-cultural populations. We accept pretty much everyone who comes to us, no matter what his or her insurance status may be, or citizenship legality. This opens the door to patient population full of those who may not only have just a different cultural background, but also patients who are actively living outside of the country that come here specifically to be treated at our hospital. Another major topic that pertains to my role is the realization of how significant nursing's ability is to influence healthcare outcomes. In Week 2 discussion post, we talked about this in more detail, and I thought more about how much we spend at the bedside and how much time we spend there versus PT and OT and doctors especially. Being with our patients so much at the bedside, we have the power to influence them by encouraging them with what's important to their recovery, such as therapy that they may not want to participate in at the time, but also things like keeping a clean environment, keeping their pain under control, and just having an overall positive attitude when caring for them. I feel that Roach's entire 5 C's of caring are important in our daily interaction with patients and our nursing advancement. I feel like commitment is incredibly important when it comes to obtaining cultural competence as well as influencing healthcare outcomes. It's easy to become burnout in nursing, especially depending on the population we work with. In the trauma setting, it can be frustrating to care for the person who is driving drunk and almost kill the person who's on the same floor just a few rooms down, or the parent who killed their child in an accident because they were high on drugs while they were driving. It's during these times that our commitment to the profession and the betterment of society that we remember why we became nurses in the first place. Because for every drunk driver, there's another patient who is a victim and needs compassionate care too. And when caring for those who it's hard to give care to, I have to remember that it's only by the grace of God that I don't have an alcohol or drug problem that put me in the same position. Thank you.